SDGs, social responsibility, and the health sector. Why should a health ministry care about private sector engagement? Simply because it's going to help the health ministry to do more. It's going to help it to be more effective. It's going to help it to advance the healthcare goals and objectives that it has set. It's going to help it to advance the health sector related sustainable development goal activities it's doing. Why? The private sector in many countries is spending tens of millions of dollars a year in health sector activities, especially in countries that have an economy based on extractive sector, on oil and gas and mining and timber. These companies are spending on healthcare activities not because they're out to change the world or be do-gooders. They're doing it because it's important for their business model. It's important for their social license. It's important for their engagement with local communities. It's important that the healthcare facilities be there for their workers' families. It's important because smart businesses are recognizing they need to find a way to bring communities along with their progress, and that makes for better business. But what happens in so many countries that I see is we have this tens of millions of dollars of private sector money going into healthcare, going into supporting health sector related SDG progress. We have Ministries of Health spending their budgets on the same objectives, on the same goals, on the same set of SDGs, but there's not an effective collaboration. So often ministries don't have a strategy, a plan on how they engage the private sector so that you can bring together the resources that's already there, so that you can bring together the capacity and do more, have more impact, advance the SDGs further, not by having the private sector contribute more, but by everybody working together smarter, by being more efficient at creating more health sector impact, more SDG impact in the health sector per dollar spent. And that's doesn't happen by accident. Smart governments, smart ministries of health are sitting down, they're investing in the strategy and planning that is allowing them to say, here's where the private sector is working in this area, here's where we can help the private sector get more value from what they're already doing, here's where the private sector can help us get more value from what we're already doing, here's how we can come together and do more, how we can create more social value for the same level of financial spending. That's what's happening in many countries. Other countries are catching up, but you're seeing, as I work around the world, you're seeing this trend where ministries are saying, how do we engage the private sector to work with us on SDG related activities, not to spend more, but to do more, to spend smarter, to do smarter, to have more impact for every level of public investment or private investment. How can we be more efficient?